good evening, ladies and gentlemen. Thank you for being here today. I am delighted to have the opportunity to speak to you about diabetes mellitus. Let's begin. Definition of diabetes mellitus is a disease with characteristic hyperglycemia occurs due to secretion disorders such as insulin action, or both, and is a group metabolic disease. American Diabetes Association 2019. According to the American Diabetes Association 2020, diabetes mellitus can be classified into the following general categories. 1. Diabetes mellitus type 1, 2. Diabetes mellitus type 2, and gestational diabetes mellitus. Causes of diabetes type 1 diabetes. Type 1 diabetes occurs when the body's immune system mistakenly attacks and destroys the pancreatic cells that produce insulin. The causes blood glucose levels to increase, triggering damage to the body organs. Type 1 diabetes is also known as autoimmune diabetes. The cause of type 1 diabetes is still not known for certain. However, there are suspicions that this disease is related to genetic and environmental factors. Cases of diabetes type 2. Type 2 diabetes is the most common type of diabetes, namely around 90 to 95%. Type 2 diabetes occurs when the body cells become less sensitive to insulin, so that the insulin produced cannot be used properly. This condition is also known as insulin resistance. Apart from these two types of diabetes, there is a type of diabetes that commonly occurs in the pregnant woman, namely gestational diabetes. This type of diabetes is caused by hormonal change during pregnancy, but usually the sufferer's blood sugar will return to normal after delivery. Symptoms of diabetes. Some of the characteristics of diabetes or type 1 and type 2 diabetes include often feel thirsty or very hungry. Symptoms of diabetes. Some of the characteristics of diabetes or type 1 or 2 type diabetes include often feel thirsty or very hungry, frequent urination, especially at night, weight loss for no apparent reason, decreased muscle mass, blurred vision, urine contains scatterness, the body gets tired and weak easily, wounds become more difficult to heal, it is easy to experience infection, such as in the gums, skin, vagina, or urinary tract. Diabetes factor. A person will be more at risk of developing type 1 diabetes if they have the following risk factor. 1. Age 4 to 7 years or 14 years. 2. Have a family history of type 1 diabetes. 3. Suffering from an illness caused by a viral infection. 4. Suffering from autoimmune disease such as Graves' disease, Hashimoto's disease, and Addison's disease. 5. Experiencing injury to the pancreas due to the infection, tumor injury, accident, or side effect after major surgery. Meanwhile, type 2 diabetes is more at risk for someone with the following factors. 1. After 55 years old. 2. Have a family history of type 2 diabetes. 3. Rarely does physical activity or exercise. 4. Having excess weight or obesity. 5. Suffering from prediabetes. 6. Suffering from high cholesterol. 7. Suffering from high blood pressure or hypertension. Meanwhile, there are also some people who experience prediabetes, which is a condition when the glucose in the blood is above the normal range but not high enough to be diagnosed as diabetes. However, a person with prediabetes can also suffer from type 2 diabetes if it is not treated properly. Nursing management, diet regulation, physical training, independent blood glucose monitoring, insulin therapy, knowledge about diabetes, prevention and self-care. The therapeutic goal for each type of diabetes is to achieve levels of normal blood glucose without hyperglycemia and serious disruption to the patient activity pattern. Supporting investigation to diabetes mellitus laboratory, CT scan, EKG, cek blood sugar, 1. Pemeriksaan gula darah, 2. Gula darah sewaktu atau GDS, 3. Gula darah puasa atau GDP, 4. Pemeriksaan oral glucose tolerance test or OGTT, and last, hemoglobin terglikasi. Okay, that is all from me. May all those we have shared be beneficial for all of us. Assalamualaikum warahmatullahi wabarakatuh. Bye bye.